All right, good morning, everyone. Thank you all for joining us in an important conversation on family child care. I'm Beth Hess, the Managing Director of Policy here at Groundwork, Ohio. Few housekeeping items for participation in today's webinar. As you can see, today's webinar is being recorded. We do have closed captioning available. All participants are muted, but please use our Q&A for questions. You can also use the chat to get a hold of myself or anyone behind the scenes if you need assistance. We have a full agenda, so if we can't get to your request or question today, we will follow up after the event. If you provide us your email, you can also, after the event, of course, email me directly. And all participants will get a recording of the event and event materials sent to them via email after the event has concluded. So if you know folks who signed up for today but can't make it live, they will be receiving a recording. We bring you an impressive lineup today to discuss family child care. I'll provide some additional opening remarks, and we'll hear from a panel of professionals deeply committed to investing in and supporting family child care providers. Please follow Groundwork Ohio and our presenters today on social media and visit our website for more information. You can learn more about us at groundworkohio.org. We would like to express a special thank you to our funders and partners, W.K. Kellogg Foundation and the Cleveland Foundation. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. This webinar is a product of the Center for Early Learning, whose goal is to transform early learning policy by removing key barriers to accessing quality early learning opportunities for Ohio's young children, improving child's outcomes, and strengthening relationships between state and local agencies that implement early learning investments. We want you to check out our latest report, and that's why we're here today for this webinar. The last 2 years brought great attention to the lack of childcare options for families trying to return to work and the impact this has had on business in Ohio. The COVID-19 pandemic uncovered many cracks in the social service system, childcare being at the top of the list. A recent report indicates that the nation's infant-toddler childcare crisis now costs Ohio $3.9 billion in lost earnings. Yes, that's billion in lost earnings, productivity, and revenue each year. Family child care providers play a critical role in Ohio's child care delivery system and were a source of continuity and stability for frontline families during the pandemic shutdown and now into recovery. Due to their small group size and ratios, family child care settings are naturally safe, trusted environments for quality child care. Unfortunately, statewide data and research doesn't tell us a lot about these providers and the barriers they identify. Through speaking with family child care providers, we've learned that while many had to leave the profession due to financial instability during COVID, many remain. We hope this publication will serve as the beginning of a conversation necessary to bring equity and respect to the family child care profession and to identify how policy can reflect their unique attributes when considering Ohio's private choice child care delivery system. Let's dig into some of the facts and figures of family child care before moving to our panel. Over a third of Ohio's licensed child care providers are home-based. Between 2019 and 2023, 327 family child care providers exited Ohio's publicly funded child care system. During this same time period, the number of programs earning 3, 4, or 5 stars in the quality rating system increased. Importantly, research has shown that there's no correlation between state regulations for child care and child care supply. Increasing the supply of family child care providers serving children from families with low incomes requires increased public investment and support for family child care professionals. In Ohio, More than 4,000 early childhood professionals provide nurturing care and early learning experiences to young children in family childcare settings. Most of these professionals are women, and nearly 2/3 are Black. Family childcare providers face many challenges. Without addressing the challenges facing family childcare professionals, our state will fail to achieve the outcomes we know high quality childcare can provide, lessening achievement gaps, preparing children for school and life, and increasing lifelong earnings. On average, family childcare professionals earn $9.36 an hour in Type B settings and $10.32 an hour in Type A settings. This is less than half of Ohio's average hourly wage at $25.56. Additionally, most family childcare providers receive no employer benefits, paid leave, or planning time, and many qualify for public assistance. This combination of low wages and lack of benefits undermines the investments our state makes in advancing high-quality childcare. Please refer to our Family Childcare Report to learn more about the challenges facing childcare providers. Ms. Averett will also shed light onto this during our panel this morning. Provider income in family childcare is directly linked to business success. Maximizing income for family childcare professionals is based on full enrollment, full fee collection, and revenues that cover per child costs. Effectively managing these three components is not a simple task. Tuition must be based on what families can afford or are willing to pay for childcare, or what the state has set as a reimbursement rate. The strongest predictor of childcare market prices is not the cost of delivering service, but the incomes of families that use the program. Even when government helps families pay tuition, like through Ohio's publicly funded childcare subsidy, the reimbursement rate is based on a percentage of market prices, not the cost of delivering services. Family childcare providers face the additional burden of small group sizes. Losing the income of just one child greatly impacts the tuition revenue of a family childcare provider. The data and research make it clear that Ohio must invest and support family childcare providers. We offer 3 ways we believe the state can do this through our report. First, incentivize family childcare to replenish childcare deserts, especially for infants and toddlers. This includes increasing the reimbursement rate for publicly funded childcare to align with the actual costs of providing quality care in a family childcare setting. This also includes funding initiatives that increase the capacity of family childcare providers to serve infants and toddlers, funding initiatives that cover the startup costs for new providers, supporting providers in participating in the Child and Adult Care Food Program, and ensuring family childcare professionals and the families they serve are included at all decision-making tables. The second recommendation from the report is to support family childcare providers to attain scale and sustainability by creating and strengthening provider networks. Dr. Kat Glenn Applegate and Alicia Smith are joining us today to share how Action for Children is leading in this space. Lastly, the report recommends increasing early Head Start childcare partnerships in family childcare settings. The Early Head Start childcare partnerships integrate the comprehensive services of Early Head Start into childcare centers and family childcare settings. Early Head Start childcare partnerships not only benefit the families engaging in the evidence-based Early Head Start model, but also provide the family childcare provider with a network for mentoring, collaboration, support, and additional funding sources. Groundwork Ohio will be hosting a webinar next week on February 15th to dive deeper into this recommendation and the comprehensive services offered by Early Head Start. We hope you'll take the time to read our report on family childcare, and please don't hesitate to reach out to our team. It is my privilege to now welcome today's panelists. Trina Averett is a family childcare provider and Ohio State representative on the National Association of Family Childcare. Dr. Catherine Glenn Applegate is the Director of Childcare and Education Initiatives at Action for Children. And Alicia Smith is a program manager at Action for Children. So please join me in welcoming this exceptional panel today. We're going to start today's panel with Miss Trina Averett. Trina Averett has been a home-based early child care educator since 1999. Her 5-star rated program is based in Columbus, and she serves children and families through rich, holistic approaches that are child-centered and developmentally appropriate. This exceptional program is also an Early Head Start Child Care partnership, integrating Early Head Start comprehensive services into the Family Child Care program. Ms. Averett has been elected to serve as the Ohio State Representative for the National Association of Family Child Care and serves as a board member for the Ohio Association for the Education of Young Children. Welcome, Ms. Averett.
Thank you for having me.
So let's kick off today's panel by asking, I think, some of the most important, but also really hard questions. And it's what makes family child care unique? And how would you like policymakers, as they approach family child care policy, to think about that uniqueness of family child care? And what are the barriers to sustaining a family child care business?
Okay, what makes us mainly unique is that normally we're staffed by one, with possible assistance from our families because it is in our home. Also in the state of Ohio, we share our home space with our business space. So that also is very unique in how we perform our businesses. Also, one of the most interesting ways that we are unique is that oftentimes our finances are connected to how well our parents are doing, especially with a ratio of 6 to 1 or 12 to 1. Our businesses, because of ratio size or rules and regulations or how we're governed in the licensure process, we oftentimes are very closely connected to our parents and their well-being. That affects our bottom line. And then also because we invite folks into our home/businesses, we are able to form unique relationships with our parents as well. So we have the ability we're kind of seen as family, which hence family childcare. We're an extension of their overall resources so that they can provide resources for their home. The second part of that, policymakers, approaching family childcare and policy. How would I like them to approach? I would like policymakers and stakeholders to first understand that we are businesses. And I have to say that because oftentimes there's a stigma that says we're not businesses, even though we pay taxes, even though we're 5-star rated or we're highly rated, oftentimes we are not seen as businesses. So as business people, we have to plan, we should be included in plans, and especially in what we do, because I think sometimes in these systems and in certain policy, they don't understand what we do. They think we just put children in front of a TV, possibly, or they just don't get the complexities of our work. I'm sorry.
No, you're fine, Trina. I think that what you're saying makes so much sense of first seeing you all as a business to understand that this is your livelihood. So, yes, you've become family, with the children and the families that you serve, but ultimately, to keep the lights on in your business, right?
Absolutely.
To bring groceries into your own home, you have to be able to be a sustainable business. I think that makes a lot of sense to say this is the first thing that's most important. So as a business and but also as part of the families you serve, what are the barriers to sustaining a family childcare business?
Well, right now we really need to be more innovative and creative. And I really believe that begins with understanding family childcare and how we run our businesses. And in order to do that, you have to get input from us as leaders on how that is done. Oftentimes we have to work behind and maybe based off of what a center does. We're not centers, and we still provide a very critical resource as all the documentation that you showed. So just inviting us to the table as you did today to hear from me what barriers are there to sustaining childcare when approaching so that's kind of what I want. What else do I want policymakers to know? That we need equitable resources in order to sustain our business. Okay. So oftentimes we don't necessarily get what we need. It was kind of like an afterthought. You get what's left over. That's not a good way to do business. We have to start thinking about, again, what do we need to actually be in business, to actually thrive in business, as is the model for Ohio. What can we do for families, childcare providers to thrive? So we really need to take a hard look at that. And we need some right-sized rules and regulations. Recently, there was a decision made for quality rating programs for home-based providers we have an option now, I'll put it like that. And I don't think that that's what we were saying. I think really what we needed was right-sized rules for right-sized program. So we really need to delve into that so all of Ohio's children and families can still make choices that make sense and benefit their children.
Thank you. I think ending that phrase on the right size rules, right, for the right size programs is really important, Trina. And I'm sure that we have some questions from the audience that are going to come in for you as well. So I'm going to move forward with our next panelist, but I'm sure that's not the last time we're going to hear from Ms. Averett today. Our next panelist is Dr. Catherine Glenn Applegate. She is the Director of Child Care and Education Initiatives at Action for Children, helping providers and early childhood professionals meet and expand their goals for high quality, accessible care and education. Prior to joining Action for Children in 2019, Kat was an associate professor and the director of the Early Childhood Teacher Licensure Program at Ohio Wesleyan University. She's written and presented for academic, practitioner, and lay audiences on topics such as preschool quality and accessibility and families' preschool selection factors. She's also taught young children in New Hampshire and Boston. Kat earned her PhD from The Ohio State University and her master's in education from Plymouth State University in New Hampshire. She loves reading, hiking, and Motown music. She and her spouse have 2 delightful, talkative children. I can certainly relate to that. Welcome, Dr. Glenn Applegate. So we're so happy to have you here and happy to have both you and Alicia here from Action for Children. We're hoping you can tell us a little bit about Action for Children and the data you've collected through the COVID-19 pandemic, through your surveys of providers. And what did Action for Children's provider surveys reveal about the current state of family child care in Central Ohio?
Good morning. Thanks so much, Beth. Yeah, so first, let me tell you a little bit about Action for Children, and then I'll share about our survey. So Action for Children is the child care resource and referral agency for the 7 counties in Central Ohio, which includes Columbus. We have dozens of different programs and services that we're really proud of, including parenting, education, training, coaching, and technical assistance for child care providers, and a wealth of resources and data that we provide to the community at large. So with all of those, though, our mission is to transform the lives of children by supporting, empowering, and advocating for the adults who have the biggest impact on their lives, primarily their parents, caregivers, and their teachers. So through that work, one of the programs that we offer is the Central Ohio Child Care Survey, which I imagine many folks on the call today have heard about. This was born through the pandemic. So as we all remember, at the start of the pandemic, circumstances and information were continually evolving. And as the child care resource and referral agency, we knew that we needed to act and act intentionally. We were also being called on by providers and local decision makers to answer the question, what do we do? So our team continually has a finger on the pulse of Central Ohio childcare, but we knew that we needed a more comprehensive, statistically reliable data set from across our counties, across our zip codes, and across program types to really make decisions that were going to best serve the programs in that stressful time. So from that, we got the Central Ohio Child Care Provider Survey. So this is sent to all licensed providers in Central Ohio. Our most recent report is called Reckoning, Not Recovery. It was released in November, and that was the 4th survey of this type between December 2020 and November of 2022. So in this survey, we learned broadly that child care providers are under stressed. We all knew that. They are short-staffed. Enrollment is not what it was pre-pandemic. Even 48% of the programs that we surveyed reported that they're operating at a monthly financial loss, which is obviously not a sustainable circumstance to be in. If we focus in specifically on family child care providers, these circumstances are the same. However, they're further exacerbated. So there's that 48% of all providers who are struggling to operate, who are operating at a loss. That was at 61% of all family child care providers reported a financial loss. In fact, 53% of the family child care providers that we surveyed reported not even taking a salary for themselves. So like you mentioned at the beginning, Beth, we have folks who are earning poverty level wages. We have some folks who aren't taking a salary at all. These family child care providers, of course, they are professional educators and they are small business owners, like Ms. Everett said. They are also the janitorial staff, and they're the cook, and they're the meal planner, and they're the bookkeeper and the administrator, and they do it all from within their own home. So if we think about that, we have these professionals that are building brains, they are sustaining the workforce as a whole, and yet more than half of them are working for free because the dollars simply aren't there to pay themselves even a salary. There's no other profession where we would allow that to happen, but it happens here and it happens frequently. Like Ms. Everett said, and like you were sharing at the beginning, these providers are dependent on the economics of their neighborhood. They can't just simply charge more. In the absence of public dollars to pay for the true cost of quality care, providers charge what their market can afford. So even though we might know that high quality childcare costs this, if the people in your community can pay this, those providers don't have an option. They have to pay what people can afford, or they have to charge what people can afford. So these professionals are working incredibly long hours in an emotionally taxing job, and often a physically taxing job. Many do not even earn minimum wage after their business expenses, yet they are people who enable others to work, enable others to provide for their family while they're barely scraping by. And it's important to keep in mind, as you shared at the beginning, these professionals, these educators and business owners are almost all women, and they are disproportionately women of color. So just for example, of that 53% I mentioned earlier who don't pay themselves a salary, 64% identified as Black or African American. So we have a need to subsidize childcare. We talk about how we need to subsidize childcare. We have to start subsidizing childcare, but we have to be clear and honest with ourselves that childcare is subsidized on the backs of these childcare professionals who are earning inexcusably low or no salaries for the vital work that they are doing with far-reaching long-term impacts. And that's just not a sustainable way for a society as a whole to operate.
Thank you, Dr. Glenn Applegate. Those are sobering statistics, and I really encourage everyone on this call to take a look at that report that Action for Children put out, I believe in December. When I opened it and saw the connections to our family child care report, right away I said, we've got to produce something and get this information out to more people, because it is absolutely unacceptable for anyone in any profession to not be receiving a living wage, but especially in a profession as important as this, which allows other people to go to work and earn their living. So thank you, Dr. Glenn Applegate, for sharing that information. I see some questions are coming in, so we're going to make sure we've got some time at the end for our questions today. Okay, Alicia Smith is the program manager for the Family Child Care Services Department at Action for Children, where her work is focused on supporting the recruitment, establishment, and retention of high-quality family child care programs within the Central Ohio area. Alicia also owns and operates a fully state licensed and high-quality family child care program since early 2019. Previous to her role at Action for Children, Alicia worked as a licensing specialist within her state and county's family child care licensing department. Alicia earned an undergraduate degree from Capital University in early childhood education and sociology. She enjoys spending time gardening outdoors and crafting indoors with her 2 children, 3 dogs, and cat. It's a busy household there. All right, welcome, Alicia. Can you share with us today what the village is? So the village might be a new concept to some folks on the call. And how did the village begin? What's happening in 2023? And how have family child care providers been engaged in designing the supports for the village?
Yes, of course. Thanks for having me. So the idea and concept of the village first spouted from a long-standing vision that Action for Children held to basically meet the ever-present needs within the family child care community. And we wanted to meet those needs with both intention and with priority. So we've known for quite some time all of the things that Dr. Kat and both Trina have spoke on their sections. There's a need there. There's inequality. There's unsustainable systems that are in place. And we knew that for some time, and we were excited on launching a staffed family child care network. Now, what the village is, it is Ohio's very first staffed family child care network. And what that is a network of professional community and relationships that's built for family child care programs exclusively, and it's also built by family child care programs. So we talk about inviting that seat to the table. Well, this is the table. This is the table, and not only is it the table, but it's a table inside of the village, inside of the home, where we know that those are exclusive conversations that are happening there with experienced and knowledgeable program managers. So now we know that we have a task. We have a task to develop those professional relationships, networking opportunities, opportunities for continued support services for family child care programs as a whole. Now, the recent pandemic compounded that need for both the strong community and those strong support services for FCC. There was a spotlight shown on the effects of isolation on the cornerstone and foundational place that FCC holds in the child care community. When all the center programs were closing, FCC, they stood strong. We stood strong. We were the ones who were resilient because we were used to working that way. There was nothing new in that isolation. There was nothing new in those smaller group sizes and carrying a lot of tasks on the shoulders of one person. That's nothing new for family child care. We've been doing that since the beginning of time. So that's a designation of best practice that family child care programs, they do hold. They hold that as the established and trusted source for high quality childcare and education. But all of this became ever present and apparent through the pandemic. And that was basically the best place for us to make this transition, for us to pivot the conversation, pivot the focus to what was already on center stage. Now, as we become acclimated to this new normal in our childcare community, the new normal within the world as a whole, those voices of family childcare programs, they haven't gone silent. They're still ever present. They continue to speak their truth. And we do have this greater focus and intensity on what those needs truly are. So at Action for Children and in the Family Child Care Services Department, we've listened. We've always listened, and we continue to listen, and we've noted. So now it's our turn to accomplish this vision that we've had for so long, in bringing family child care programs to the table to join those conversations on how we can enact that change, especially in Central Ohio. So in 2023, we want to do more than just invite. We're just not going to place that invitation out there to join the conversation. We want to provide a welcoming and exclusive place, again, for that conversation to happen. We want that space to be safe, to be exclusive, and to be designed and tailored to the needs of the family child care community. So that's where we put the many hands together to create the village, and we're building that right now. And again, it is Ohio's very first staff family child care network. So we're excited on leading the way and building this village appropriately, correctly, and in a way that it will be able to be durable and withstand the shifts and changes that'll come and be a legacy, for family child care programs all across Ohio, especially in Central Ohio. Now, how are we engaging family child care and supporting the design of the village? Well, we first started by asking a question. We asked, what do you need? And we asked that question through our own village-specific interest survey that was sent out to all licensed family child care programs within our service delivery area. So that's Franklin County and all the surrounding counties. We received about we sent it out to 297 programs, and we received about 75 unduplicated responses. Now, from those responses, we were just able to start building the framework of where we need to begin. What we heard over and over again, that there's a need for community, there's a need for connection, there's a need for support, there's a need for engagement. So with those as the foundational blocks for the village, we designed something called a founding members group from our piloting group of participants that we have right now. And we're about over 60, we're close to 70 participants now that have been invited and interested in being a part of the village. But from that group, we selected high quality, established, provisional, it doesn't matter where you are in this process, family child care owners and professionals to design and create what the village will be all about, especially in our inaugural year. So we're going to have monthly meetings with our founding members, and those meetings will consist of, again, asking those questions. How do you define yourself? What is it that you need? Where do you see the challenges? Where do you see the barriers? Where is your biggest area of strength? And also, where's your biggest barrier that's standing in the way of you achieving that success and your strengths? So we're going to have the founding members complete purposeful storytelling trainings. We also have a peer-to-peer mentoring program that's being set up, where we have established high-quality programs partner with a provisional or maybe even a struggling program that's been around for a very long time. And we're going to have that mentoring program coincide with a business development training. So we go through all the different areas of a family child care business. It's a 10-week course. So every week when we tackle a new topic and we learn a new task or a new skill, or even sharpen the ones we already have, that'll be shared in our peer-to-peer mentoring program. So we're very excited for the things that we have coming up within the village. We are also collaborating with another program that we have that's offering services to family child care programs called The Boss. So we're collaborating with The Boss with tech supports, with business supports, legal support. So whatever those holes are that we've been asking for a long time, we're actually filling those. There's opportunities there, and we're excited just to move forward.
Thank you so much, Alicia. We're definitely excited to see how this inaugural year goes for Ohio's first staff family child care network. We're hopeful to see that those ideas spread throughout our state, which is in so much need of supporting our family child care professionals. Okay, I see we have lots of questions that came through. So let's do some Q&A before we end our panel today. So Ms. Everett, there's some specific questions for you. So let's see, we're going to go through them. The first is who has the Early Head Start Child Care Partnership Grant that you're partnered with?
I'm with OSU, Early Head Start.
Excellent. Okay, OSU right here in Central Ohio. And then there's a second question for you. It says, how did you become a leader in family child care? Oh, now my screen moved. Okay, how did you become a leader in family child care? How did you find your voice?
By just doing the work. Several years back, I knew I had to come outside of the home because things that I needed, I was getting barriers to what I needed. And so I had to come out and find out how come. So I had to make that commitment to find out different who was saying no and why. And then in addition to that, this year, or actually last year, I'm a year in as the National Association for Early Childhood Family, National Association for Family Child Care. I ran as the state rep and was elected state rep. So that's how I became the official leader and state rep for our state. I ran for the position. I've always been involved with the National Association. When I started in 1999 in Chicago, actually, I decided, my degree is in journalism. So I needed to know what I was embarking upon. So I looked to NACI, and now I'm on the NACI's board as well. And back then, National Association for Family Child Care, I got involved in that as well. That helped me, help to inform my practice.
Thank you. Would you say it is it's difficult to get involved in a leadership role from a family child care business?
There's definitely some difficulties, but we can't get around it because it is the business of our business. I think we should be a lot more innovative here. I know. We should be a lot more innovative in our practices here in Ohio. There's so many things that our businesses could be, and we could provide such a greater service in our businesses, in our business practices, that other states are doing. And so that's the uniqueness that NFCC brings. I'm able to see, I'm able to engage, I'm able to talk to other family child care providers and find out what they're doing, how they do that in their states, so on and so forth. So there's a whole plethora of things that this great state can be doing, family child care providers. And so I like to see that come.
Thank you. Okay, this question is either to Kat or Alicia. It says, does the village include unlicensed family child care? In our county, we have no licensed family child care programs and are trying to figure out how to engage the family child care providers in our community.
Yes, it does. It does. We actually invited all 37 of our pre-licensed family child care participants to participate in the village services, including the mentoring. So Action for Children has a dedicated family child care pre-licensing team, and that team is for Franklin County. And for this period until June, we are able to extend out into our outer counties and offer those services as well within our SDA. So if you are interested in joining the village, our email is thevillage@actionforchildren.org, or if you're interested in joining our pre-licensing support services for family child care licensing, it's Start Your FCC at actionforchildren.org.
Thank you. Okay, and this question I think is probably going to be for Kat. Allison is asking, she says, we need childcare for our families that have children with disabilities. It's a population that gets overlooked. What could be done to help support in-home childcare businesses serve children with disabilities?
That's an excellent question. Yes, I completely agree that it's an important population that has needs that are not always met as well as they could. Like Ms. Everett was saying at the beginning, with family childcare, you have smaller group sizes, you have continuity of care. A child can be in the same program from potentially birth through school age, which can be really beneficial for children with disabilities or special healthcare needs. All of those are really important factors, and family childcare can be a great option for that. We have supports at Action for Children to help programs feel more comfortable and be more confident in serving children with special needs. There's other opportunities, at least here in Central Ohio, to help programs gain that confidence and skill that they need to. Sometimes programs can feel like, oh, we're afraid or we're not equipped to provide the care that those children need. And I would encourage programs who are experiencing that feeling to say, trust yourself a little more and open up as a matter of equity and respect, that we take care of all children. All children deserve and need that good care. So I think that is a really important question. And one that we do need to delve into more, and how can we better support those home-based childcare providers and childcare providers of all types to fully meet the needs of those children.
Any other comments from our panel on that question? I saw some head shaking.
I do. We do have some home providers who are brave enough and can find room to accommodate those people that have special needs. In fact, I just recommended one of my parents to one, and we need resources. We need resources just to accommodate those children specific. Everyone's not lucky enough to be in a Head Start. I have some supports because I am in early Head Start, but we definitely need resources in order to do that. We know that. We need them too at the home level.
Yeah, I think, Trina, that it makes me think of your comment of the right regulations for the right size program, and, also the right resources, right, to match the children that we're serving. Okay. Oh, some more questions popped in while you guys were talking. That must have sparked some thoughts. Let me see. Oh, I see our friend Steph Genesio is here today. She's a family childcare provider who serves on Groundwork Ohio's advisory council. So thanks for being here, Steph. And she's asking a question of Trina. She says, we have parent education and parent engagement, but shouldn't we add a component entitled family childcare advocacy that opens up the concept and educates the provider on simple ways they can advocate for themselves and the families they serve?
I think that's absolutely necessary. We're not trained public speakers usually. So I do know of an organization that is in the area in Central Ohio, but actually all throughout Ohio, that's working in the CEO project. I've been working with them, and they actually do help to build leadership skills for care providers specifically. That's one of the things that they took on as a project. So I'm very happy to be affiliated with them. But absolutely, we need to know how to advocate for ourselves and to find our voices, because we know what we're doing. And I think it is our responsibility to inform policymakers, the public, families about how we do it. Yes, we need one more job. And that's it. We got to tell people what we do and how we do it.
Thanks, Trina. Needing one more job, right? Isn't that the story of all of our lives, right? We always take on more and more, especially in pursuit of helping children and families. Okay, let me see where we're at with our questions. I see we've got some comments in there. I do see that there's a few questions about early Head Start collaboration. And I'm going to ask that we hold some of those questions for next week, because we'll have a whole hour-long webinar on early Head Start. But I think a question for you, Trina, is how did you get involved initially with the early Head Start collaboration?
I literally hounded them down when I found out they were in Coming from Chicago, I already knew that they were already involved in homes, at least in Chicago, not the early Head Start, but Head Start. So there's a bit of a difference in terms of who you serve. But once I found out they were here, I kind of went to everything that they were at and it was like, I need to be in your program. And I'm so glad that I did, really, because it is an added support, a financial support, of course, but also the other comprehensive services that they offer as well. And so I won't say any more about that, but I definitely contacted them to make sure that I could participate.
That's great. And I see we have some family childcare providers who are interested in learning more about that early Head Start collaboration. So I'd encourage you to join us next week, but also please feel free to send me an email outside and I can help connect you to your early Head Start grantee in your area. So please don't hesitate to reach out. I think, let's give folks another few moments for questions. We have a few more minutes if we have any more questions. These have been really great. Let's see. All right, I'm not seeing more questions coming through. Thank you so much to our panel. You all are doing such great work every day to serve children and families in Central Ohio, but even more importantly, your work has reached well beyond Central Ohio. We're excited to see what happens with the Staff Family Child Care Network. That's a mouthful. It's easier to say the Village, to see how that expands throughout our state. And Ms. Averitt, thank you so much for your national advocacy as well and representing not just Central Ohio, but the state of Ohio in that work. Thank you to all of the advocates, partners, and policymakers on the webinar today. We're hopeful this conversation gives you some things to think about or some action steps you can take in your local community. As Groundwork Ohio Center for Early Learning continues the conversation of healthy development for young children, we invite you to join us as a partner and ally. For more information on Groundwork Ohio or the Center for Early Learning, please visit our website. Thank you all for joining us and have a wonderful rest of your day. Thank you again, panelists.